Hello, my name is Takuya Ishikawa. I'm a gastroenterologist at Nagoya University Hospital in Japan. Today, I'd like to discuss our recent article published in GIE. The title is Randomized Trial Comparing the Franseen Needle versus two types of sharpened-tip 3-prong needles in endoscopic ultrasound-guided tissue acquisition from solid pancreatic lesions. Endoscopic ultrasound-guided tissue acquisition, or USTA, is essential in diagnosing pancreatic diseases, especially pancreatic cancer. Accurate tissue sampling is crucial for precise pathological diagnosis and subsequent therapeutic planning, such as chemotherapy and genomic profiling. Currently, the Franseen needle is widely used and known for its excellent diagnostic capability. However, puncture difficulty remains a significant challenge, particularly in smaller or hard-to-access pancreatic lesions. Therefore, we evaluated two new types of 3-prong fine needle biopsy needles, the trident and 3-point needles, that are designed specifically to enhance puncture performance. This prospective, multi-center randomized controlled trial was conducted at Nagoya University and 5 affiliated institutions. 185 patients with pancreatic lesions were randomly assigned to receive either the conventional Franseen needle or one of the novel needles. Our primary endpoint was the tissue correction rate from the first pass. Results showed that the conventional Franseen needle had a slightly higher tissue correction rate compared to the novel needles, 96.8% versus 92.6% respectively. Although this difference was not statistically significant, the novel needles did not meet our predefined criteria for non-inferiority. Interestingly, the novel needles significantly outperformed the conventional Franseen needle regarding initial puncture success and ease of puncture. This finding suggests that these new needles could be particularly beneficial in challenging clinical cases or for endoscopists with less experience, by reducing procedural stress and potentially improving outcomes. In terms of histological diagnostic accuracy and amount of tissue collected, there were no significant differences among the three needles. Adverse events were minimal and comparable across groups, indicating that all needles are safe for clinical practice. To summarize, while our study indicates that the conventional Franseen needle maintains slightly higher tissue correction rates, the novel 3-prong needles offer superior puncture ease and reliability, especially in difficult cases. So this suggests a clear clinical advantage in selecting these novel needles under specific circumstances, despite their marginally lower correction rates. Future research should focus on refining needle design further and exploring their performance in specific patient populations, such as those with very small lesions or technically challenging anatomical locations. Thank you for listening, and I hope this research contributes meaningfully to your clinical practice. Bye-bye.